Hi guys, welcome to today's revision screencast. What we're going to be looking at on today's screencast is we're going to be looking at the responses, adaptations and additional factors that affect the skeletal system. So it's the last screencast we're going to be doing on the skeletal system. So once we've revised everything that skeletal system done, you can come back to this at any time. But of course we need to move on. So this is exactly the same setup we've done before. We're now just looking at responses, adaptations, additional factors which are here. Again, you can come back to this in your own time and see, all right, I didn't quite get that. I need to work on this, for example, the functions of the skeletal system, or I need to remember the memory method that we used for areas of the skeleton, for example, cute teddies love some cuddles, so spines, curves of the spine, etc. Again, when it comes to exams, we need to get this question. So look at the mark allocation. Is it worth a mark, 2 marks, 3 marks, 4 marks, so on? Circle important information. If it's talking about adaptations of something, circle adaptations, that's important. Memory method, can you think of the memory method we use to remember that? Translate the memory method. Can you extend with an example? So responses of the skeletal system to a single sport. So as you're aware, when we start to exercise, our heart rate increases, so does our breathing rate as well. Now, these are really apparent, they're obvious because we can feel them, we can hear them, we can see them on other people. When it comes to the skeletal system, it's not so obvious, but skeletal system, when we talk about responses, what do we go through as soon as we start to run around, as soon as we start to kick a football, throw a netball, we get some responses of the skeletal system, and this is what we're going to be covering right now. So there are two responses of the skeletal system to exercise. What are they? If you can remember them, get them down. If you can't, I'm going to quickly jog on right now and get on to the next part, which is going to be fill in the blanks. If you pause it now, you can get on with that. If you can't fill in the blanks, these are the two responses of the skeletal system. Again, pause this. Once you've got this down, we'll go through. So the answers are increased uptake of minerals and increased production of synovial fluid. So as soon as we start to exercise, as soon as we go out onto a track and start to jog, we will get an increased uptake of minerals and we get an increased production of synovial fluid. This should become apparent to us with regards to the last screencast in the terms that we did synovial joints, and we looked at the structure of a synovial joint. So we looked at the fact that the synovial membrane secretes synovial fluid into the joint. You've got cartilage at the end of either bone, hyaline cartilage. So this is, with regards to synovial fluid, we get an increased production of this synovial fluid. So responses continued. So increased mineral uptake. What I want to know is which minerals will become absorbed. So which minerals do we actually uptake? If we're talking about skeletal system, think about this. Think about what your parents made you drink when you were younger when it came to getting big, strong, healthy bones. And what effect will this have on our body on our bone density? Okay, get down the answer if you can. So calcium. So the minerals that we absorb or our bones absorb when we initially start to exercise is calcium. This will increase our bone density. This will make our bones stronger. We start to jog, go on a little bit of a wander around a track. Our body straight away will increase its mineral uptake. It will increase its uptake of calcium into the bones. This will then make our bones stronger, more dense. So what type of exercise helps increase mineral uptake? I've literally just given it away. Okay, so you have weight bearing exercise, jogging, so running around or squatting in the gym, bench press. All of this will help increase our bone density, our bone strength. So weight bearing exercises help with that. That is important because it has such an effect on the adaptations as well as the additional factors when it comes to our skeletal system. And there is a picture for you of someone doing a squat if you're unaware what a squat looks like. Next one, increased production of synovial fluid. How does this impact on performance? If you can just look at that, kind of fill in the blanks and get that filled in. If you pause this, because I'm going to tell you the answer right now. So it is increases range of movement or motion at a joint. That is why an increased production of synovial fluid has an impact on performance. So it will increase the range of movement at a joint, and it will also cause it lubricates. Got myself then. So it lubricates and protects the joint. That is what increased production of synovial fluid does. It will lubricate the joint, it will protect the joint, it increases our range of movement. This means we're going to get an overall effect of decreasing our risk of injury. Decreasing injury is the outcome of an increased production of synovial fluid, as well as lubrication. Lubricates the joint, increases range of motion, nourishes our hyaline cartilage, so our hyaline cartilage stays healthy. So this is just an overview of what the responses do, i.e. response to the skeletal system to a single sport, increased uptake of minerals, stronger bones equals decreased risk of injury, calcium is what we uptake, increased production of synovial fluid means we get an increase in range of movement, increased protection of joint, decreased risk of injury. Both of them decrease risk of injury. Okay. Adaptations. So now that we've done our responses, we've done adaptations or chronic responses. Okay, and these happen over a long-term process. It could be a long-term training program, which is 7 to 8 weeks, and we get some adaptations of the skeletal system. There are 2 adaptations of the skeletal system to exercise. What are they? If you think of those responses, one of the responses pretty much has an effect on one of the adaptations that we get. So first of all is that one, and secondly is that one. If you can pause this and get that down, then we're going to go through the answer. So increased bone strength. That's pretty self-explanatory, considering one of the responses to exercise is we increase our mineral uptake, i.e. we get more calcium into the bone, which makes our bones stronger, more dense, i.e. an adaptation is we get stronger bones, increased bone strength, increased our bone density. We also get an increase in ligament strength. Okay, so ligaments connect bone to bone. They also become stronger when it comes to an adaptation of the skeletal system. They're the only 2 you need to remember with regards to the adaptations. So here's a question for you. Jeremy has taken part in a weight training program to improve his skeletal system. How may the adaptations that occur impact on his rugby performance? 4 marks. Give that a go now if you can for me. So if you pause this. Okay, so this is where you are getting your answers and your marks from. An increase in bone strength and density. 1 mark because you've explained one of the adaptations of the skeletal system. Will mean that Jamie is less likely to suffer injuries such as fracture. That is 1 mark. That's how it's going to impact on his rugby performance. He's less likely to get injured, which means he can perform for the whole season potentially, which is going to make him potentially a better rugby player. Jeremy will also experience an increase in ligament strength. That was the other adaptation. So there's your 2 marks. You get 4. So it's going to be 1 mark, or 2 marks for adaptations, 2 marks for expanding on those, making his ligaments more pliable and subsequently reducing the risk of injury. Both of them have an impact on his sport in terms of reducing the risk of his injury. Done responses, done adaptations. Now what we need to look at is the additional factors affecting the skeletal system. So what else affects our skeletal system when it comes to sport or when it comes to everyday life? Can you identify the 3 additional factors affecting the skeletal system? Pause this and give that a go. If you couldn't, here's a fill in the blanks for you. Hopefully that will jog your memory a bit. If you pause this and again have a think, maybe look at your trigger and answer slides. So arthritis, osteoporosis and age, they are the factors that affect the skeletal system. Right now we're just going to be looking at arthritis and osteoporosis. So what is arthritis? If you could have a go at filling in those blanks for me, that would be much appreciated. Okay, so arthritis is the inflammation within a synovial joint. That is what arthritis is. So how does regular exercise help prevent arthritis? Think back to the responses that we've just discussed. Okay, arthritis is inflammation within a synovial joint. Here's a synovial joint. What is this part in here known as? It's secreted from the synovial membrane. So what does the synovial membrane secrete? It secretes synovial fluid. How does regular exercise help prevent arthritis, do you think? So increased production of synovial fluid. Okay, this means that the joint is lubricated, which reduces friction between the bones, increased minerals to the cartilage, resulting in a healthy joint, i.e. preventing arthritis. Arthritis is the inflammation of this joint and it causes pain and stiffness. Now, if we start to exercise, we get more synovial fluid released into this joint capsule. Then what happens is this hyaline cartilage here gets all its minerals and it starts to kind of like get nourished, which means it stays healthy, which reduces friction between this bone and this bone, which results in this joint staying healthy. So that is what regular exercise does with regards to preventing arthritis. So osteoporosis, what is osteoporosis? Can you fill in the blanks here? Pause this. Right, okay, osteoporosis, weakening of bones caused by a lack of calcium. Now, again, what does regular exercise help prevent? How does regular exercise help prevent osteoporosis? Think back to the responses of exercise on the skeletal system. What is the other one? We get an increased production of synovial fluid. We also get an increase in something that is to do with osteoporosis, which is this weakening of the bones caused by lack of calcium. We get an increase in mineral uptake, i.e. we get more calcium into the bone, which means we get stronger, more dense bones, which is counter that. It means we're not going to be suffering with osteoporosis, or we're not going to get this weakening, this brittle bones, because we're getting calcium. So can you please answer this question for me? So pause this and answer these two questions for me. So identify one type of exercise that Anita could take part in to help prevent the osteoporosis from getting worse. When we looked at responses, one of the responses was an increase in mineral uptake. One of the questions asked was what type of exercise helps increase mineral uptake. The answer was weight bearing. So you're going to be having squatting or jogging within there or running. Explain why weight bearing exercises will help to prevent osteoporosis from getting worse. Answers: weight bearing exercises, e.g. running, squatting, that would get you an answer fine. Weight bearing exercise would stimulate the bone to take up minerals, i.e. calcium. This will reduce the rate of bone loss, helping to maintain bone mass by making the bone stronger, more dense. So there's your answer for that. So analyse the impact of participation in netball on Eve's skeletal system. This is asking you now to analyse. It's a 6-marker. It's asking for quite a lot of information there with regards to 6 marks. You're going to have to make 6 points and potentially elaborate on those points as well. Analyse the impact of participation in netball on Eve's skeletal system. When it comes to this question, you have to be thinking of the short-term responses of the skeletal system to that single exercise, the adaptations that may take place, as well as the additional factors. Now, the memory method we used for this was Sol Man B, if you remember. Now, give this question a go with just this here, Sol Man B. See if you can fill these in, first of all. Once you've filled them in, then you're going to have to make sense of the memory methods. Then you have to turn it into an actual question. Pause this now. If you're struggling with this, now you have this available. Okay, so the S stands for synovial fluid production, O stands for osteoporosis. This is decreases with exercise. Uptake of minerals, ligament strength, increased mineral uptake, arthritis, age, nutrients to cartilage, bone strength. You pretty much have your answer in here. So if you needed to wait for this, can you please answer this 6 marker now, using this to help you analyse the impact of participation in netball on the skeletal system. Your answer. So strong and healthy bones due to increase in bone density, reduced risk of osteoporosis. This is because we're getting mineral uptake, and increase in mineral uptake such as calcium, which makes our bones stronger, more dense. Healthier joints due to an increased thickness of the articular cartilage. Why are we getting that? Well, we're getting that because we've got an increased production of synovial fluid. Synovial fluid nourishes articular or hyaline cartilage, which means we get a healthier joint. Reduced chance of injury because of greater ability to shock absorb. Reduce risk of developing arthritis in later life. This is all due to, again, the increased production of synovial fluid, because arthritis is the inflammation within a synovial joint. Stronger ligaments, which increases the stability of a joint and therefore less risk of injury. So we've got that stronger connective tissue. Better lubrication of joints with synovial fluid because of the increased production of synovial fluid. And finally, decreased strain on joints due to weight management from participation. You don't need to get all these points. You could just get 4, 5, 6 of them, as long as you're actually expanding on them. It's not just a matter of bullet pointing. You have to be able to kind of like put it into context with regard to netball and Eve's actual skeletal system. So thank you for listening to the skeletal system screencasts. Next week we'll be looking at the muscular system. Thank you. Bye.